Good afternoon and welcome back to Facebook Live. Today is June 5th and we're here on the Oneida Nation Reservation. I'm with Chairman Tehassi Hill and Vice Chairman Brandon Stevens, who are going to be discussing some of our intergovernmental relationships today, as well as we'll have our medical update from Debbie Danforth. As you notice, we're social distance. I tell you, every week we have cleaned off our surfaces. We have our masks, so we're trying to maintain safety and adhere to all of our guidelines. I just wanted to say that I know we repeat some of this stuff every week, and you may say, I heard that last week, but we get new people watching our video every week, and there are over 3,000 people every week that view Facebook Live. A lot of them come on after it's started and watch it when they get home from work and such. So we do have to repeat for some of the new people that come on and make sure that they know where we are, who we are, and what we're doing here in Oneida, Wisconsin. So after Debbie has her update, we'll go to Chairman Hill and Vice Chairman Stevens. And as always, please keep your questions relevant to the issues that we're here discussing today. We do our best to get them answered in real time. We're a little bit short-staffed today, but we're going to try to get them all answered in real time. And with that, I'll ask Debbie to go ahead and give us an update.
Thank you, Bobby. Good afternoon. I'm going to start out with just providing the numbers like we normally do. Globally, we have 6,663,729 positive cases, with 391,655 deaths. For the United States, we have 1.8 million positive cases and 108,211 deaths. For the Indian Health Service, we have 12,072 positive cases, and that was as of yesterday. Albuquerque has 775 positive cases. The Bemidji area, which we are a part of, which is Minnesota, Wisconsin, and Michigan, has a total of 253 positive cases. And the Navajo Nation has 6,481 positive cases. Phoenix area has 2,015 positive cases. For the state of Wisconsin, we have 19,892 positive cases with 626 deaths. Brown County alone has 2,361 positive cases and 38 deaths. Outagamie has 246 positive cases with 8 deaths. And for the Oneida Reservation, Oneida jurisdiction, we have a total of 46 positive cases. For the Brown County portion of the Oneida jurisdiction, we have 19 positive cases. Outagamie County jurisdiction on the reservation, we have 27 positive cases with, unfortunately, we have 2 deaths due to COVID. Those cases for Brown that are still in isolation right now, we are at 2. And those cases that are still in isolation for Outagamie, we have 2. I just want to provide a couple additional updates from the Health Division and just let the community know that we continue to operate our drive-through testing site at the former Woodland Church site on Highway 172. The site's open from 8 a.m. to 3 p.m. and if you feel that you may have been exposed or you want to be tested, please feel free to drive over to the site and a staff person will greet you there and provide you instructions on what that process is. If you're a patient of the Oneida Community Health Division, you do not have to call, just drive over to the site to be tested. If you are not already a patient of the Health Division, it may take you just a few minutes longer because they'll do a mini registration right on site, and you do not also have to call ahead of time. You can go right to the site, drive to the site, and you'll be tested. The process just takes a few minutes longer if you're not a patient. Be prepared, however, when you do go over to provide some type of identification, your tribal ID, driver's license, and the staff will provide you with some basic instructions as to what your next steps are to follow. And the results normally take between 5 and 7 days, but often it's sooner than that. And the staff will contact you to report your results. I do want to mention there has been a lot of communication in the community in terms of a small incident that happened towards the end of April, early May, where we had a large number of tests that were taken and submitted to Exact Sciences Lab, which is the lab that we utilize in Madison. because of the fact that we get our test kits from Exact Sciences through the state. Unfortunately, the influx of the number of tests that were performed during that time frame with Exact Sciences, they were not prepared to be able to address the number of tests that were performed at that time. And so, unfortunately, Oneida's test samples, along with some of the other test samples from some of the other sites that are doing drive-through testing, were not able to be tested, and some of the specimens had to be thrown out by Exact Sciences because of the length of time that they were out. Had nothing to do with Oneida's site, had nothing to do with our staff. Everything that our staff performed was exact to the way it was supposed to be, but unfortunately Exact Sciences had the issues, and so 30 of those testing specimens had to be recollected, and we gave people the option that they could come back in and get those tests done, but it had nothing to do with Oneida's actions at all. So I just wanted to clarify that, because there was some negative comments made regarding our staff, that we did something incorrectly, and I just want to certainly apologize to the community, but to assure you that everything we did was correct. Everything our staff did was correct, and I do want to take an opportunity to thank all of the staff at the drive-through testing site, because these staff have volunteered to do and take on this drive-through testing site. They have agreed to be out there on a daily basis, and they've exposed themselves to anyone coming in to get tested, so they're at a greater risk in terms of potentially turning positive from the results. But we've been very fortunate because of the preventive measures that we've implemented, that none of them have really had the opportunity to test positive, and we're fortunate for that. They utilize all of the personal protective equipment that they need to, and they take all of the necessary precautions. So we thank them for all of their hard work. And since the drive-through testing site opened, we've actually done a total of around 575 tests at that drive-through testing site, and our rate right now, we've had 37 positives that have come out of that testing site. So we're very fortunate that our staff have been doing the hard work that they do. Just one more comment, and that is, again, with all of the activities that you see on the news, all of the various rioting and protesting, I just want to stress enough to the community that it's still very, very important that you continue to practice safety precautions. Social distancing, wearing your masks, disinfecting, making sure that you have some type of a facial cover when you go out. I've been out in the public and I've seen, you know, because the warm weather is out, people think, well, the virus is gone. And it's not. It's still very prevalent, and it's still just as dangerous for us as it was at the very onset. So please make sure that you continue to practice social distancing and wearing your masks. Thank you.
Chairman Hill.
Good afternoon, everyone. Again, I'd like to thank for this opportunity to address the community on Facebook Live. And I'll just take a minute to congratulate all the graduates, whether that's Head Start, kindergarten, 8th grade, high school, and college. I think that's all very important milestones in someone's life, getting those things completed. So again, thank all the recent graduates for the class of 2020. We had a great turnout for the Oneida Nation High School parade. It was a very well received community event with the high school students lined up here at the Norbert Hill, and the community invited to drive by and decorate their vehicles, and congratulate all the 33 high school students from our Oneida Nation school system. So thank you to those organizers and all those who participated. My main topic today is talking about our governmental relationships within the state here primarily. And I just wanted to, update the community that we do have regular calls with the Governor Evers and Lieutenant Governor Barnes on a regular basis, weekly, to discuss the challenges that we are still facing and some of the successes as well. And so that's a great opportunity that we haven't had in the past, to have that regular communication with the governor and all of the secretaries of the departments of the state. So I think it's a great step forward with Governor Evers and the tribes. to have that opportunity on a regular basis. And I also participate on a weekly call with the Mayor of Green Bay, Mayor of De Pere, and the Brown County Executive Troy Streckenbach as we navigate this system, and that's related to the Unified Command for the public health emergency that we are currently in. And so I think, again, that's just another great opportunity, having built these relationships and the outreach with the different local governments as well, having that unified command in place, having the county, De Pere, and Oneida working together to work to have a much greater impact in the safety of our community, I think has gone a long way in slowing the spread of COVID-19 in our community. So I think that's a great win for all of us being able to come together. And myself and Vice Chairman Brandon Stevens were able to visit the Unified Command Center out in Allegheny County today to see how that operations work and hear the different types of reports that happen there. And so I think, again, we thank Unified Command, all those who participate in that structure as well, for the great work that we've been able to participate in. And they were very happy that Oneida was alongside them, working together to address this public health emergency. And so I think that was also another great opportunity within our local area here to work with other government entities to try to address this public health emergency. And so with that, I'd just also like to, as Debbie just mentioned, again, to continue to social distance. I know it's, like I said, graduation season and it's getting nice out. And so if you elect to gather in crowds, small or large, again, please wear a mask to the best of your ability, maintain social distancing, and regularly sanitize, your hands. I think these are, very simple steps to mitigate some of the exposure, and I think that is important that we try to do our best to mitigate the spread of this disease. And so I think things, as we roll forward, you will continue to see many changes in our nation and how our programs and services are available or interact with the community and patrons. And so I just want to, make sure everyone's aware that, with the spread of this COVID-19 flu, that some of these precautions that have been put in place, many of them will likely be permanent as COVID-19 is here and it hopefully goes away soon. There's always another new flu that pops up that people don't have very much immunity to. And so with many of these precautions that we're taking now in the workplace, will also, I believe, help prevent the spread of other future flus, as many people are aware that, flu is a very widespread disease that actually a lot of people die from every year. And so when we put these precautions in place in the future and maintain some of these precautions, I just want to assure you that it is for the public health and safety of our community and our patrons and our employees. And so I just, again, thank you for tuning in today, and I'll turn it over. Thank you.
Vice Chairman Stevens.
Good afternoon, and I'd like to welcome you to this edition of Facebook Live. I'm here to talk about the national outlook and federal coordination. The tribe has received federal stimulus funds, and how it impacts Oneida Nation is we received the funding from various stimulus funding packages, but how we use those funds are dictated by federal law and Treasury Department guidance. The majority of the funds, approximately 80%, comes from the CARES Act that we received from the Department of Treasury. These funds are intended to aid in economic support. We have a team in place to ensure that these funds are used in accordance with the law. Another portion of the funding, at about 11.5%, is designated for health care. This includes administering tests buying personal protective equipment, providing health care as it relates to COVID, and more. We also receive smaller amounts of funds to assist with food, housing, social service programs, including welfare assistance, elder services, and cultural programming. The nation has a process in place to ensure that these funds are being spent as they were intended by federal law and federal guidelines, while at the same time safeguarding the community's health, safety, and general welfare. Every tribe is unique. We all may face the same problems, but the solutions to those problems differ from region to region and tribe to tribe. Each tribe will determine how they are going to fight this deadly virus. Some tribes are focusing on response. Our brothers and sisters in Navajo and New Mexico have been hit the hardest by COVID. Most of their efforts are treating the sick. Other tribes have not had any positive cases in their communities. These tribes are focusing on prevention and preparedness should the virus come to their communities. Other tribes are focusing on a combination of these. The nation has positive cases within the community. We are doing everything we can to ensure that those people are getting the medical attention they need, while at the same time trying to stop the spread of the virus. We are also looking at the future and how we need to ensure the next time something like this comes along, that we have the infrastructure and knowledge to fight it. We are also focusing on recovery. We are opening our businesses back up with the safety in mind. Departments have been creating reopening plans, and our public health area is assisting in those plans. Federal agencies has also been very responsive to the tribes. What they're doing, food programs, health care, and economic development. Some of our federal partners are very, very responsive, like the Midwest BIA regional office located in Minneapolis. They hold a weekly tribal leaders call provided by the Midwest tribes and an update on funding opportunities, supply and equipment, availability, issues that are occurring nationally, and more. On these calls, other federal regional partners such as FEMA, the Federal Emergency Management Agency, Offices of Justice Services, Bureau of Indian Education, Housing and Urban Development, USDA, Environmental Protection Agency, Office of Self-Governance, and more. The IHS and Bemidji area office, of which reside within their jurisdictions, hold weekly tribal and health director calls and update the Bemidji area on positive cases, funding available, supplies, and testing equipment available. They even coordinated a donation of 2 pallets of gowns to the health center earlier this spring. In addition to our regional federal partners, the nation has been involved in weekly national calls with federal partners such as IHS, BIA, BIE, the White House. Some others that join these calls from time to time include the U.S. Surgeon General, FEMA, HUD, USDA, EPA, the Department of Administration and Families, and more. These calls give tribal leaders the opportunity to ask questions, voice concerns, advocate for our needs, and hold federal partners accountable, and educate federal partners on the issues that arise in Indian country. We're also able to get other information from other areas of tribes and how they're dealing with particular policy calls and decision making and prevention and future calls on how to prevent further cases. As horrible as this virus is, there's some opportunities that we can take advantage of. Congress and the rest of America are hearing about the health disparities in Native American communities compared to the rest of the U.S. population. We are taking advantage of this attention by telling our stories, advocating for our communities, and educating our partners and friends on issues and needs. We are building new and productive relationships with federal partners, as well as building new and stronger alliances with other tribes and tribal organizations. Together, we are drawing attention to the broken promises that were made by the government and fighting to secure funding to ensure health, safety, and the welfare of the United Nations. And on the outset, looking forward, we're looking at the elections and how some of these responses, could be handled a lot differently. But if we want to make an impact, the elections and making sure the community and the broader Native American communities are actively engaged in voting and making sure their voices are heard. Native Americans make over 2% of the United States population, and the research suggests that we as Native voters have a low voter turnout in non-tribal elections. The United Nations encourages our tribal citizens and community to vote in all election cycles, including the U.S. President and Congress, who make important policy decisions that affect Native people. Increasing Native participation in non-tribal elections will lead to better responsiveness to the needs of Indian country. Some of the key issues for Indian country include insufficient funding of federal programs, violence against Native American women, the lack of political representation, and educational reform. In recent news, the Wisconsin Election Commission has voted to send all registered voters absentee ballots for the November election. If you want to vote by absentee ballot in August, you must request one online using myvote.wi.gov. For additional information about the electoral process, you can go to the United Nations webpage and click the Government tab and go to Elections and the Voting tab. I'd like to thank you for being able to share some of the national issues with Facebook Live and our community. Thank you.
Thank you, Vice Chairman Stevens, Chairman Hill. We've got a couple of questions that are going to be directed to Debbie at first. One is, I guess, just more of a statement about, I know that we had all of our employees and all of our patients tested at the Anna John Nursing Home, and the community was pretty well aware of the outbreaks that were occurring in nursing homes around the state. So I'd like Debbie to maybe react to that statement, as well as the question is, when are things going to start returning back to normal at the health center, when you're going to start taking more appointments outside of emergencies and COVID appointments?
Thank you, Bobby. We'll start with the nursing home question first. And back about end of April, early May, we did test all of our employees and all of our staff at the nursing home, as well as all of our residents. We completed a total of 137 tests, and thankfully everyone was negative. Guidance has been issued by the state of Wisconsin now that is in process of being developed right now, so we're waiting for the final say on that. However, the recommendations that we anticipate coming from the state is that they are going to require that we continue to test staff. Some guidance has said weekly, some have said twice a month. And that residents be tested at least once a month. And so we're awaiting that guidance to come down from the state in terms of what and the frequency of that testing. So we will continue to be looking at that process. Unfortunately, visitation continues to be restricted for the residents' safety, basically because of the fact that we don't want to potentially expose any of our residents to the COVID virus. So staff that come in daily are monitored, their temps, their signs and symptoms are screened on a daily basis before they get into the facility. We're not allowing any drop off of anything for residents. Basically, we're trying to protect those residents to the best of our ability. But I do want to mention that one of the local nursing homes in the Green Bay area I just saw had made arrangements through family members to have all the residents outside, and they performed a drive-by parade where all of the residents could see their families as they drove by and wave. And similar to our graduates the other night, they went ahead and decorated their vehicles so that the residents had that opportunity to at least see their family members, and it kind of lifted their spirits. In terms of normalcy for the health center, we are continuing to look at what we can do with the existing staff that we have. We are increasing the number of visits within the clinical areas. We are doing some physicals at this point. Basically, it's a different process that is the new normal now. So when you call to make arrangements for a physical with your primary provider, you may have some of that part of the visit done over the phone. So some of your visit will be screened by the nurses over the phone with you, some of it will be with the provider over the phone, and then they'll come in and have you come to have the remainder of your physical done in a physical contact. But things are different. We know that we're looking at staffing levels and what we can do to increase staffing levels. Dental is probably the biggest area of concern that we have right now, because a lot of the work is generating aerosols. It generates droplets into the air, and so we're looking at what measures can be taken in terms of how we can increase the number of visits and access to our dental area. And certainly staffing has an issue, so we're looking at trying to see what we can do to accommodate the needs of the community to the best that we can. Behavioral health itself has gone primarily all through telehealth services, so they do have some things that are available on site, and we do have some measures that are in place, but at this point we're trying to increase the number of visits, but hopefully July, August we'll be able to increase that again. But looking at continuing with delivery of medications the way we currently are, looking at staffing and how that goes, and basically looking at important steps as far as preventing the social distancing. So we have plexiglass dividers that have been put up, and so we're gearing up to be able to increase the number of visits coming into the facility.
Thank you, Debbie. I'm not quite sure we can answer this question. It's sort of I'm not sure if it's an individual, or the question is, what happens to an employee who has to self-isolate because of another employee tested positive, and now they're off work and have no paid time off to use? What options for compensation are there to cover lost wages? I know that's an HRD question, but can anybody, can you give some insight?
I can give you some recommendations in terms of what happened within our facility, because we did have several employees that were out in particular departments because of COVID or potential exposure to COVID. And so what a lot of our staff did was they donated hours for that particular individual to assist them in being able to not have to worry about a paycheck, but making sure that they still had to comply with the isolation. And so our staff all donated hours for those individuals. And I know I've heard in other departments that staff have been more than willing to donate hours to those individuals.
Okay, thank you. And I think this is in regard to the funding that came, the CARES funding. So I think this is what it's in referred to is, and I know Brandon, we talked about this prior to the beginning of the segment today, and that is, will the tribe get individual monies from these stimulus funds?
Well, that's a major question across the country, and there's a lot of tribes that are doing it outside of the Treasury's guidance. And so what we're trying to do is make it more impactful for the community members through our existing programs that deliver services to those in need. And what I'm seeing is a lot of those other tribes have a lot less members than we do. I'm seeing about 2,000 to about 5,000 members, where about as triple, more than triple that amount. And so we're trying to make the most of the impact with the funds based on the priorities of the tribe and the General Tribal Council. And so that's going to be a difficult endeavor to do, but I think we have established a good process and a good team to make sure that those funds go to direct impacts to the tribal members as well as businesses as well within the tribe.
All right, thank you. This question comes up quite often. Does anybody have any insight as to when bingo and some of the other gaming may expand? If we don't know, we don't know. I mean,
I would say we don't know, but it's also working in coordination with the health officials on establishing those requirements. And as gaming opened up in phases with just slots, table games didn't open up because the proximity of individuals to the games make it difficult to operate under safety precautions to limit the spread of COVID-19, and that's the same with bingo. And so establishing those criteria and how we move forward is a slower process, because we want to make sure we have everything in place, we have the necessary protection and equipment that's needed, and the plan that would come forward.
Okay, how is the tribe implementing Indian preference? Well, Indian preference has been furloughed. I don't believe we can furlough Indian preference as a law. Maybe an individual has been furloughed, but I believe it's the responsibility of our HRD department and those who are in the hiring procedure to assure when they draft the job descriptions and when they do the interviews that Indian preference is taking place. So that's a responsibility of HRD right now. There's another part of that question. The second question is, what is the rights of tribal employees who are not employed because of the violation of tribal preference? If there's been a violation of tribal preference, then that should be filed with HRD or within our court system if there's a violation. It's not something that we can answer here today. It sounds like it's an individual initiative that somebody has to take to process their complaint through the available entities that we have, either through HRD or through our court systems. Sound right? Okay. Also, in terms of an employee protection plan, are we familiar with whether or not there's the establishment or any funds for employee protection? And I'm guessing it's for wages. I think that's maybe another question for HRD. As usual, we ask you to try to keep the questions relevant to the presentation today. Our presentation today has been focused on the intergovernmental relationships between the Oneida Nation and our local and state, federal, and intertribal relationships. So I think that pretty much ends the questions that I have that are relative to that. Are we receiving a per capita this year? No. We've mentioned that several times that there will be no per capita distribution due to the lack of funding, as well as the General Tribal Council stipends have also been suspended for now. So in closing today, we just want to remind you that today until noon they had a distribution of grocery boxes that are food distribution. They will also be distributing them on June 12th and June 19th for the future. So you might want to stop by there. We were told they had 1,500 grocery boxes to distribute today. There's no criteria. You drive up and they were giving them out without any names, or I don't even believe you had to get out of the car to pick those up today. Also, unfortunately, we have to remind you to stay away from Oneida Lake. The lake is closed due to the phase of construction that was planned earlier in the year, and they were not able to complete that. So lake and the parks are still closed. We also have to remind you that the Oneida Annual Powwow is canceled. Apple Fest has been canceled. The Great Law Recital, Indigenous Games, and Oneida Casino's anniversary has been canceled. On Monday, June 8th, we're going to have our guest from the Radisson to talk about the Oneida Radisson, some of the changes that they have been undertaking over the summer, some of the impacts of the pandemic on our hotel industry, and some of the plans for the future. So we'll have that on Monday. I also want to announce that the Oneida Nation tobacco burning ceremony to give thanks and to offer prayers for the Oneida community will be taking place on Thursday, June 11th. The entire community is invited. It will be at the Norbert Hill Center Powwow Grounds under the arbor. Hopefully we have good weather for that tobacco burning. It will begin at 7 a.m. Bring your own chairs. We want everybody to socially distance. You can sit with your family, but make sure that your chairs are spaced apart from one another. You may wear masks. We encourage that as well. It's a prayer ceremony and everyone is welcome. So please feel free to invite your local spiritual leaders. Bring everybody of all walks of spirituality, ethnicity, and age are welcome. We just want to remind you, We're a nation of strong families that are built upon Jigni Yungwali Hodu and a strong economy. Wat Jilayo means we're all family. We want to remember that, and we want to encourage everybody to participate next Thursday. As I said, remember your chairs, remember your prayers, and we'll see you next week, Monday. Y'all go.